This is case number 32, pelvic fracture, medical dictation. Ready? Let's write. Since we have just been discussing fractures of the pelvis, doctor, can you tell us about some particular case in your experience that would be of interest to us? Answer: yes, I recall one that is quite interesting involving an osteomyelitis of the iliac spine and crest. Question: will you kindly tell us something of the history of the accident as related to you by the patient when you made your first examination, doctor? Answer: well, he said that he had bumped himself against a work table while at work, and he complained of severe and intense pain in the region of the right anterior superior iliac crest. Just below the belt line, near the top of the trouser pocket, you can feel a bony prominence. That is where the anterior superior iliac crest is located. He stated that the pain increased in severity from the time of the injury and that he had to quit his work. Question: what did your examination of him disclose, doctor? Answer: my examination disclosed the pain was localized along the crest of the ilium and that the pain increased on motion, tensing the right abductor muscles. There was tenderness along the crest of the ilium and definite swelling at that point. There was no redness, but there was moderate increase in local heat. There was marked tenderness on palpation and a sense of fullness in the bone in that area. On the medial surface, there was a moderate size, firm, hard, tender mass. Question: what treatment did you suggest, doctor? Answer: I had an x-ray plate made which showed a typical osteomyelitis of the right anterior superior iliac spine and crest. Question: taking the plate, will you indicate the osteomyelitis that you say is present? Answer: you will notice that the bone is decalcified and appears to be moth-eaten. If you compare the wing of the left ilium with the wing of the right ilium, you will see on the right a very low-grade active osteomyelitis, while on the left side the outline is smooth, distinct, clear, and homogeneous, with none of the moth-eaten appearance that is so definitely evident on the right side. Question: when you use the word decalcified, just what do you mean? Answer: the bone has been deprived of lime salts or the chalky substance known as calcareous matter. The bone will not show up on the x-ray with the same density and whiteness as normal bone. Question: now, what is an osteomyelitis, doctor? Answer: osteomyelitis is an infection or inflammation of the bone marrow or of the bone and marrow. Question: what is the accepted treatment for the checking of this disease? Answer: surgery, excision of the affected part. Question: is there any way of controlling or checking the disease than by removal of the infected portion? Answer: at the present, this is the only accepted method. Question: what is the nature of the operation you did on the patient? Answer: an incision was made over the ilium, and the periosteum was incised and reflected both laterally and medially until good bone was exposed. Then by the use of a chisel, the infected bone was removed. There was a very large amount of granulated tissue and pus present. Question: doctor, you say the periosteum was incised and reflected. What is the periosteum? Answer: that is the covering of the bone, and it is also a bone producing mechanism. It is about as thick as 3 sheets of paper and covers all bones.